Hello, my name is Gwen Fannin, and I am doing a movie analysis today for Morehead State University Nursing 461, Nursing Leadership and Management. The movie I'm going to be evaluating today is the 2001 drama Wit, that was directed by Mike Nichols and is based on the Pulitzer Prize winning play by Margaret Edson. This movie is about the character Vivian Baring, who is an English professor that has just found out that she has stage 4 metastatic ovarian cancer. So before I go into the ins and outs of the movie, I kind of want to set the stage for the characters so that you understand the interplay between them as we go along. Vivian Baring is played by Emma Thompson, and her character is a very educated, intelligent, strong-willed, insensitive, viewed by some, woman that teaches English literature, and she is very well versed on the 17th century poetry, metaphysical poetry of John Donne, and her class is renowned as being a very difficult class. She has a very strong disposition. She's very insensitive to the needs of her students. She's very demanding and unforgiving with her deadlines, and basically is kind of an introverted kind of person. She's kind of socially isolated. She really doesn't have friends. One of her English professors in school encouraged her to go out and to be with friends, but she was all about studying and learning, and was very focused. So she is now this English professor, and like I said, people viewed her class as being very difficult. One of the next characters that you will see is Dr. Kalikian, played by Christopher Lloyd, who is the oncologist that is very driven by his research on cancer, and is focused on getting Vivian to take 8 months of full dose chemotherapy for their research. And he presents everything to her in a very intellectual, intelligent manner, because she is a professor, just assuming that she knows things. And of course, her being very knowledgeable, she doesn't say that she doesn't know. But when he talks about the treatment, he says that this is the best that we can offer you, and it is for knowledge's sake. And of course, she is a very collegiate kind of person, so she was all about doing this for the sake of knowledge. Then another character that's important is Jason Posner, who was a former student of hers, but is now a resident with Dr. Kalikian, that is also very high energy about research. Again, another person who is not very intellectual and not very social. His bedside manner with patients is definitely not the best, but he is very excited about the research, and was very, when he found out that she was the patient, he was very proud that he passed her class and used it on his resume, actually, because her class was so renowned as being hard and difficult to pass. And then one of the other last characters in the play is Susie, who is going to be Vivian's nurse throughout the stay. And she starts out in just little bits and pieces at the beginning of the movie and doesn't seem very significant, but then plays a more significant role as it gets toward the end of the film. So now that's all the characters, and basically what the movie is based upon is Vivian's portrayal. It's almost like a verbal journal of how she tolerates and sees this treatment that she has to undertake. So she is very isolated in her room. She actually talks to the camera on several occasions, and is like doing a monologue about her feelings and about what she's going through, and she has flashbacks of her childhood and of her college years to kind of show you more of what's inside her and what she's like and what her feelings are like. The director uses a very good technique called breaking the fourth wall. Normally, the characters in a play or in a movie are immersed in the movie, and when they break the fourth wall, they actually acknowledge the audience and speak to the audience. And this works very well in this film because it gives you a connection with Vivian and her plight, so to say, and the feelings that she's feeling, and it really connects you with her, so that the whole impact of the movie is so much more powerful, because you are able to sympathize, and you feel like you know her because she's talking to you and drawing you into the film. So as Vivian starts this journey, it is really imposed upon her that she is tough, and that she is a collegiate person, and that she has pursued knowledge all of her life, and that she is doing this great duty by withstanding full doses of chemotherapy for 8 months. Since this is a research project, and the fact that most people know that stage 4 metastatic ovarian cancer is terminal, they never actually say those words to her, but just keep encouraging her that, full dose. And of course she agrees, and she keeps going regardless of the side effects that she has. So part of the problem with this movie that she has is that she is a person who analyzes words and meanings of phrases and people's words, and then all of a sudden words have no meaning. It's almost like the whole interaction that she has with the doctors and everybody who comes in is so scripted. One of her favorite things to interplay with the audience is the phrase, "How are you feeling?" And they ask her this repeatedly, day after day after day. Even while she is sitting there throwing up in an emesis basin, they're still asking her how she is feeling. When she's doubled over in pain, they are asking, "How are you feeling? Are you having pain?" And so these words become meaningless because they have no meaning. So that's the irony in this movie, that words mean nothing. So the healthcare related issues that are brought out in this movie, there's several. First, there's conflict of interest between clinical therapy and clinical research. There becomes a fine line of what is best for the patient and what you're actually doing just for the sake of research. And this is what happens to her because they keep encouraging her and demanding that she takes the full dose of chemotherapy regardless of how difficult it is for her. And this is when Susie starts stepping in, trying to advocate for her. Vivian is actually admitted at one point for fever and chills because her counts are so low, and Susie calls the resident, her former student Jason, and he comes and refers to this as the shake and bake instead of looking at Vivian as a person. And Susie tries to advocate for her, saying, she can't take any more of this. These doses are too much for her. And his response to that was that she's tough, she can do it, and he just goes about his merry way. It was very insensitive of how they treat her and push her, and are not looking at her as a person, but just as the ends to a means for their research and getting clinical data. Another healthcare related issue in here is clinical incompetence. You see this throughout the movie, and being a healthcare professional, these things happen. There is one very good, when Jason does her initial physical exam, he puts her up in the stirrups, and Susie has walked out of the room, and of course, like all of us women who have had pap smears and pelvic exams, there has to be a female in the room if a male is doing the exam. So he leaves her up in the stirrups and goes to find Susie so that he can do this exam, just very unmindful of her position and how he left her, which is a comment that Susie makes when she comes back into the room. Another incident is when she has to go down for a CT scan, and the tech who is doing the CT scan actually wheels her into the room in a wheelchair, helps her onto the table, wheels the wheelchair out of the room herself, and sits down and does the scan. And then when the scan is over, she comes back in and says to Vivian, "Where's your wheelchair?" And she's like, "Yeah, I was kind of busy." And she's like, "Well, how are you going to get out of here then?" And she's like, "Well, I don't know." So this tech is blaming her for not having a wheelchair that she herself took out of the room, and it just showed just negligence toward the patient, very, again, insensitive, and just, overall clinical incompetence. Another issue is the issue of informed consent. at the beginning when Dr. Kalikian is talking with her and giving her a very educated explanation of what's going to happen, he didn't go into any detail of the side effects that she was going to have and what was going to happen, and even what her prognosis was in the end. Just saying that for the sake of knowledge, that she needed to take the full doses for 8 months, and that it was the best that they could offer her. So there really wasn't any discussion about what was going to happen to her. And as it gets closer toward the end, Vivian at the beginning was very unapproachable. She didn't want visitors. She didn't have visitors. Her parents had died, earlier in her life. Her father of a heart attack, her mother of breast cancer. So there was absolutely no one for her. But as it started getting toward the end, and she was starting to feel sicker and realizing that, she wasn't going to get any better, she started craving human interaction. And she explains this again, like speaking to the audience. So she would intentionally occlude her IV line, so the nurse would have to come in, again being Susie, and interact with her. And Susie would show kindness to her, and then Vivian would reach out. And finally, toward the end, she did reach out and say, I'm scared. And Susie sits and talks with her, and Vivian again expresses, that her cancer isn't getting any better. And Susie says, it's not that it's not shrinking, it's just not improving. And she said, they should have explained this to you. And Vivian replies, I already knew. And she said, what do you mean? And she said, I read between the lines. So it was still something that wasn't verbally expressed to her. It's something that she just assumed from the conversations. This is where Susie then discusses another health-related issue, which is end-of-life decisions. And she speaks with her about being a do not resuscitate, and explains to Vivian, and Vivian does decide just to be what we call a DNR. And even down to the end, when this event actually happens, Jason walks in the room, and by this time Vivian has been on a morphine drip. Even though Susie tried to advocate for her to have a patient-controlled analgesia, or a PCA, so that she could be more alert and control her own pain control, Dr. Kalikian would not hear of that and wanted her to have a morphine drip. And Jason actually walks into the room and asks, how are you feeling today? And Vivian has died. And he doesn't realize that at the beginning. And then when he does, he panics and calls a code blue and calls a code team and is doing CPR on her. And Susie actually pushes him out of the way, which is the first real emotion that Susie shows. Actually, she pushes him out of the way and says no, she doesn't want this. The code team comes and starts CPR, and they're not listening to her, and she says she doesn't want this, she doesn't want this, she's a DNR, she's a do not resuscitate, and they don't listen to her, and she finally has to yell at them and scream at them to tell them to stop. And then their reaction again is that one that I feel like is clinical incompetence, where they feel bothered by the fact that they came to a code and it was a do not resuscitate. So the movie is so powerful and so full of emotions, and just well done, to where you are sucked in to this woman's life, and that you feel for her. And her realization is that a woman who didn't want human contact in the end is craving human contact, and how she was so remorseful for being insensitive, and she wished that she had been more sensitive to people and been more kind. So at the ending of this movie, the phrase that comes, which was from one of John Donne's poems, was "Death be not proud," because in the end you are stripped of everything. You have nothing, and you need people, you need that human contact, you need that kindness, and you lose all sense of pride when it comes to that. And this is a wonderful movie. The movie is fabulous. It's a powerful movie, and definitely one that everyone should see. Thank you so much for your time.